All right, so what are the risk factors? Getting older. So you guys, the epidemic is here, isn't it? In Florida. 25% of people live past 85 now. Isn't that amazing? The average longevity in 1907, when Auguste D lived, was 42. Now, men are living late 70s and women maybe early 80s, and in Japan, even older. So people are living into the risk period. That's why dementia is an epidemic, because people are at risk before they die. Other risk factors are carrying this ApoE4 gene. Apolipoprotein E4 is a very important risk gene. It accounts for 20 or 25% of Alzheimer's disease. Being a woman, one of the big reasons women are more at risk is that they live longer. They're in the risk period, right? That's a very important reason. If you go to a nursing home, you can play a game called Spot the Man. Yeah. Many women live a lot longer than men, so that's one of the important factors. But we think that there's also other biological reasons. We think that estrogen and other factors are also probably important. And then head injury, you're hearing a lot about that, and factors associated with atherosclerosis. So I mentioned that earlier. So what is the genetic factor? The risk factor, the genetic factor is that 60 to 80% of Alzheimer's disease is inherited. 60 to 80% based on the twin studies. So, oh dear, we can't do anything. It's all genetic. It's all predetermined. Not true, right? So you know you can prevent heart disease, which is genetic. You just lower cholesterol, treat the blood pressure, exercise, treat your diabetes, get your weight right, stop smoking. You can do it, and it's all genetic. So don't be in despair, please. So we have found lots of genes, and this is the latest one, TREM2, that Mayo had a big part in finding. So the next thing we're going to talk about is putative protective factors. Before we go into this, I have to give you a warning that a lot of what I'm going to tell you now is epidemiology, and epidemiology doesn't prove anything. It just raises a hypothesis. So let me show you what I mean by that. So Japanese eat less fat and have less heart disease than British and Americans, but the French eat more fat and have less heart disease than the British and Americans. Japanese drink little wine and have less chance of heart attacks than the British and American, while Italians drink much wine and have less heart disease than the British Americans. So you can see that speaking English causes heart disease. So what I tell you, don't believe it. But here's one you'll want to believe. Here is the amount of chocolate eaten by Nobel laureates. And you can see there's a perfect correlation. The more chocolate the country eats per head, the more Nobel laureates they have. This is true data. This isn't made up data. You can see other things correlate with eating chocolate. Maybe it's wealth, and maybe it's research money, and so on. So that's why epidemiology doesn't prove anything. All right, so let's talk about education. Dr. Katzman went to Shanghai, and he did this study, and he showed, for example, that women 75 to 84, the dementia prevalence, how many had it, was 4% if they had more than 6 years of education, but 18% if they had less than 6 years of education. Everybody said, Dr. Katzman, so you did a pencil and paper test? These illiterate people to test for dementia? We don't believe you. I remember that. And it turns out it's true. It's been reproduced in many, many studies. People who are more educated have less dementia. So let's look a little bit why. The interesting was the Nun Study by Dr. Snowdon a few years ago. A very smart linguist who worked with him decided to analyze the essays these nuns wrote before they took their vows. They had to write an essay why they wanted to take their vows. They were age 23. And they would write this essay, and this very clever linguist analyzed these essays for grammatical complexity and density of ideas as surrogate markers for linguistic talent. So you'd had the upper half and the lower half on these scores. Now the hypothesis would be that everybody would get dementia, but those who were smarter linguistically, it wouldn't show. They'd have the same pathology in the brain, but it wouldn't show because they had reserve. They had done a lot of education. And the exact opposite happened. What actually happened was that those with low density of ideas had pathology, had tangles in the brain. Those with high density of ideas had very few tangles in the brain. So high density of ideas at age 23 linguistic talent seemed to protect you from getting dementia when you died at age 85. Now, why might that be? Could it be that if you're a smart nun, your job might be that you'll be a teacher and you'll keep your mind busy? Whereas if you lived in the same group, you might be the cook. So it might be the job. Or it might be that genes that make you a smart nun also prevent Alzheimer's disease. Could it be that? So those are interesting hypotheses. We don't know, but these are interesting studies. Here's another replication of this. This is the interesting study from Aberdeen in Scotland. They took the IQ of everybody at age 11 in 1932, and then they followed all the people who still lived in Aberdeen. And this is the IQ score of those who did not get dementia by 1997. Their IQ score was 36, whereas those who did get dementia, their IQ score at 11 was 29. So 11-year-olds who are smart, have a higher IQ, have less chance of getting dementia when they live to age 75 or so. So interesting sort of supportive notion in the Nun Study. Here is what I call a circular study. Even although this is published in the New England Journal and was done by Dr. Verghese, but also Dr. Katzman's study. So Dr. Katzman's study had an aging study, and he asked people when they got in, they were cognitively normal, what do you do to keep yourself busy? Well, I play music, I play bridge, I do square dancing, I do crosswords, I don't do anything. And he added up a score of how busy, cognitively active these people were. Read books. And those who played frequently had less chance of getting dementia 17 years later. Now, why that's a circular argument, because I'm going to make the case that Alzheimer pathology starts about 15 to 20 years before you get the symptoms. So maybe those who are not playing very much have already started. So we don't know if it's the chicken or the egg here, right? Is it the disease that's stopping you from playing, or is playing stopping you from the disease? So that's a circular argument in many of these epidemiology studies. All right. Well, as you know, we know some of the genes that definitely cause Alzheimer's disease. These are dominantly inherited genes, and if you have them and you live to a certain age, you will get the disease. So dominantly inherited. And all of the genes, the three of them, presenilin 1, presenilin 2, and the amyloid precursor protein, mutations of those 3 genes, all of them increase amyloid, the amyloid protein. And we can take those genes and we can put them in mice, and the mice deposit amyloid in their brain. And now we can try treatments. We can treat our Alzheimer mice. Can we prevent the amyloid being deposited in the brain? All right, well, one of the things we can do is enrich the environment. We can give them toys, we can make the space bigger, we can give them an exercise wheel so that they exercise a lot, and look what happens. Those who have standard housing versus enriched housing, that's amyloid in the brain. Much less amyloid in the brain in those with an enriched environment. So I'm sure your grandchildren have enough toys, but maybe more. Maybe an exercise wheel as well. So this is an important point. And they've separated the enriched environment from the exercise, and they both work. Exercise is very protective of the brain, as is an enriched environment. They've done that as well.